All right, so I told you that the numbers have surged, they've gone up, so have the... Let's take a look at it right now. The total confirmed cases 6,486, and that's a jump from the previous 6,269. Well, hopefully you've taken time to digest that figure. But let's look at the regional breakdown. What does this say? Greater Accra region alone, we're looking at 4,699, top of the chart. Ashanti region has 988, and it goes on and on. Eastern region has 106. Western North has 57. The Volta region has 44. In the Northern region, 34. OT region has 26, Upper East region has 21, Northeast region has 2, and the Bono region has 1. Unfortunately, 31 people have died as a result of this pandemic here in Ghana. But good thing is, recoveries remain have actually jumped up 1,951. That gives you an idea of the figures that we're dealing with. The good thing, I must say, as I always do, is that people are recovering. It is not a do or die affair, but it is also very dangerous, and so you should be very careful with it. Send us your thoughts and your comment on our WhatsApp platform 0540-109-009. But like I said today, we're connecting with our correspondent across the country. I'm beginning from up north. I have Martina Bugri and Albert Sori. Martina Bugri is for the northern region, Albert Sori is for the Upper East region. They're joining us with what has happened so far in their regions, and I'd love to hear from you on that. Let's get on Zoom right now as we join our correspondent. Martina, Albert.
Hi, Gifty.
Hi, Gifty.
Okay, so I have Martina, I have Albert, I have Fred Kwame Asari, and I have Nathalia Kwanzaa. Good to have you guys. Let me begin with Martina. We start from all the way from the north. Martina, what is the latest in your region as far as COVID-19 is concerned?
The latest is that we have 34 cases, and these are contacts of the 2 people who tested positive after the foreign nationals, that's the Guineans and the Burkinabés. Their contact tracing has resulted in the current cases that we are getting. Now, the region started with 10 cases, and that's those foreign nationals. Then 2 people came, contracted the disease. And then their contact tracing got 200 people. And out of the 200, the figure jumped. And then it went to 19, then it went to 20. And then currently we have 34. I must say that the regional health director we spoke to some few days ago was worried that because of the delay in the release of the results of the 200 cases they had sent to, there was the fear that we're going to have crisis in the region. He says there's going to be a challenge in tracing those contacts. But we are told that they have started the contact tracing as we speak now. That's the current situation.
That's the current situation. I'll come back to you as we deal with a little bit more of the other dynamics. But let me connect with the Volta region, Fred Kwame Asari. Fred, let's start with what's the latest is. Starting from, telling us from where you started. Okay, looks like Fred is unable to hear me. Martina, let me stick. Okay, Fred, you'll have to unmute your sound. Do you hear me, Fred?
Yeah, I can hear you. Can you hear me?
Fantastic. So tell us, as you heard Martina say, Martina takes us through the genesis of the outbreak in her region, how it started and where they are now. Can you give us that breakdown before we go along?
All right. So the Volta region recorded the first batch of cases on April 12th. That was 9, out of which 6 were recorded in the Ketu South municipality. As we speak now, we have 44 cases in the Volta region, 44 active cases in the Volta region. Pohwe has 10, who has 8, who has 2 cases. Akachi South has a case, and then Ketu South has 22 cases. Agotim also recorded a case, but then as we speak, there's an additional case in the Hohwe municipality, which brings cases in Hohwe to 11. So out of the 44 or 45 cases, 11 were recorded in Hohwe, which means that Hohwe is gradually becoming the epicenter in the Volta region. But then also 28 out of the 45 cases, I should say, have recovered. We will still have some 14 more cases that are at the isolation center, out of which 11 are housed in Ho, and then 3 are in Hohwe. I spoke to the Deputy Regional Director earlier, and then he mentioned that 4 of the people or the persons who were infected with the virus and are at the isolation center have not exhibited symptoms, but then the rest have exhibited symptoms, and then they are responding to treatment.
We'll break this down to a very, casual conversation, if I should put it that way, to put all of you at ease. We just want to have a very fun-filled regional conversation, although we're dealing with a very difficult subject. So, since we're in the Volta region, let me come to you, Ivy. I'll come back to you, Fred. Ivy, what sort of response are we getting from the residents? We've reported about how some of them are hesitant to wear masks, etc. Take us through the response that residents have given so far. Ivy, do you hear me? Okay, I'll stick with Fred for a while longer. Fred, you've talked about the case count and you've talked about what the regional directorate says they're doing. In terms of the treatment, what more can we know about how it is being treated? I mean, there are several places where we went and heard that residents are not happy with siting of isolation centers. What is the story in your area?
Well, here in the Volta region, I should say there are 2 isolation or treatment centers. There is one in Hohwe, and then there is also one in Ho, that is outskirts of Ho. So, as reported in other parts of the country where residents are not happy with the siting of isolation centers, I should say that here in the Volta region, there has not been any complaint with that. Also, with regards to how treatment is being done, I have not gotten much information on how treatment is being done or what model of treatment is being used to treat these persons that have been infected with the virus. But I should say that I spoke to the authorities earlier, and then they confirmed that all 14 active cases that are at the isolation centers are responding to treatment.
Right, that's okay. Ivy, do you hear me now? Okay. Ivy doesn't seem to hear me, but she'll give us a top up on what's happening in the Volta region in the past that she has monitored. Let me go back up to the Upper East region. Albert Sorry is there with us. Albert, take us through the case counts, the hotspots. What are they?
Yes, so Gifty, we have 26 cases here in the Upper East region now. This number has actually stayed that way for 2 weeks now, if my memory serves me correctly. But let's go back to when we first recorded the first case in this region. The first case was recorded on the 3rd of April, and it was the pregnant woman whose story we later told about how she faced stigma after she recovered. So from the 3rd of April, we had 1 case. The cases moved up to 4 cases by the 12th of April. And then it increased to 8 cases and 1 death by the 16th of April. It then moved to 18 cases by the 26th of April, and then onwards to 26. And since we recorded the 26th case, we have not had any update of new cases that have been recorded in this region. But then the first 3 cases were, even up to the 8th case, were discovered by contact tracing of the first case. Only 1 other person in the Boko municipality, was not a contact of the first case by the time we recorded the 8th case. Now, what the Regional Health Directorate has been doing is to, give press releases to give us updates of the cases. after we recorded the first case, they used a press conference where they gave us the details, but subsequently, they've always released, a press release to give us the updates of what the cases have been. So 26 for the past 2 weeks,
Okay.
we haven't heard anything as far as new cases are concerned at the moment.
So, Alex, that sounds like a good thing, really. 26 cases, and for the past 2 weeks, you haven't had any updates. So there are two things here. That there hasn't been any update from the Health Directorate, or there hasn't been actual recorded cases. What we can report right now is that there hasn't been any updates from the Regional Directorate, right?
Yes.
Okay, well, that's a good thing. So if you live in the Upper East region, why don't you send me a WhatsApp message? I'd love to hear what you think. What is it that you're doing there that seems to be working? Because if for the past 2 weeks there hasn't been any new record, certainly something good is going on there, and would love to hear what that is. Okay, so Albert, I will come back to you. The other two of our other colleagues have joined us, Richard Kojonyako from the Central Region, and we also have Precious Semevo, who's also joined us. Let me go to Ina Thalia Kwansa, Western Region. Ina, what's your update?
Yes, Gifty. So the Western Region recorded its first case on the 27th of April. That was in Shama. As of now, the Secondita Pride Metropolis case count at 120. And the Secondita Pride Metropolis is the epicenter for the Western Region, followed by the Takwa in Suaye municipality, which has 63. And then Shama, which recorded the first case, has 4 cases. When you go to Ahanta West has 10 cases of the COVID-19 cases. And then when you go to Efia Kwesimensim, which is about 5-10 minutes drive from Secondita Pride, they have 18 cases recorded. Pristia Honi Valley has 4, and then Elembele has 3. When you also go to Umpoho, they have 1 case, and then Izma East has 10 cases. Gifty, the trend has been that over the past 2 weeks, the Secondita Pride Metropolis is always recording a case. Takwa started with 2, and now they have 63. So each day we have new cases being recorded. This has brought a lot of conversation. I engaged the Deputy Western Regional Minister Monday, and she told me that the Regional Coordinating Council feel very bad about the way cases keep on rising, because for them, they feel they're putting in all the stringent measures to, put this on a hold. For instance, when Accra and other parts like Kumasi was locked down, the Secondita Pride Metropolis started this barricade at our main entrances, checking people's temperature, checking those who are coming in. The Secondita Pride Metropolis also initiated the social distancing at the market, which got most part of the nation talking about it, where other people even emulated it. So if the cases keep on rising, she thinks there is more to do, and then they would not leave anyone go scot-free if you are found culpable of not following the directives given.
I find it interesting that in the Western Region had an example that everybody was sharing around, especially with how they treated the markets center. That people, there were mappings on the floor to make sure that there was social distancing. So it's pretty amazing that the cases are rising much faster in the Western Region than it is even in the Upper East Region. How do the residents feel about this? Do they feel responsible? Are they not, adhering to the protocols apart from what happened in the markets? What's happening?
You see, the residents are anxious, but these people are also not staying in their homes. Like the market we had about a month ago, which had this markings of 1 kilometer in a box with a separate 2 kilometer before you get to the next trader. Now, when you get to the markets, they are crowded. A lot of people are trooping into the market. They are not staying home. You go to town, and people are not really using the face mask. 2 weeks ago, the Assembly, STMA, together with the Navy and then military, had to go out in town. It's either they warn you or at least some few strokes on your back to let you know that we are in serious times.
Yeah.
When in front of the STMA, I stayed there for about an hour monitoring how the security guards were checking people in their cars. So when you come across that path, heading to secondary regional office, and you are not in face mask, what they do is they get you down. When you prove to be stubborn, they take you into the assembly, they keep you there for some few minutes. But if you cooperate, they just find a face mask or something for you, and then you get it. And then there was also an issue of social distancing in the truckies and taxis. They were not observing it, so they had to enforce the law then 2 weeks ago. But you know, people are recalcitrant. They follow it for some days and then they go back to their old ways. Even though the cases are rising, they are anxious. But as to go through the protocol, it is becoming difficult. And this is what has become an issue for the Regional Coordinating Council.
I mean, to be fair to them, it's not easy to adjust to a new normal as we are right now. But it looks like there's the need for more enforcement and more reminders for people to observe these social distancing protocols. I'll wrap up with you soon, Ina. But let me bring in Richard Kojonyako, Central Region, you know, sort of a brother or sister to the Western Region. Richard, when we come to the Central Region, give us the case count and how far we have come. But I'm particularly interested in the prisons and the fact that a prison there recorded a case that led to officers having to self-isolate. Give us your update and add a bit of that as well for us.
And so let's start from the 14th of April, where we recorded one case. We're told that it was an imported case. The person traveled to the UK, returned to Cape Coast, and then was tested later. And so he recorded, they recorded their first case. So they started doing the contact tracing and so on and so forth. And then later, 2 additional cases were recorded in the Central Region. And then on the 26th of April, we shut our case count short up to 17. And then on the 28th, we still maintained the 17th. And then on the 30th, we moved a notch higher to 21. And then 2nd May, we went to 38. On the 7th of May, we recorded 50. And then on the 9th, we recorded 58. And then the subsequent, on the 11th, we recorded 127. Ever since then, our cases have been going up. Now we are getting closer to about 300 cases in the Central Region. And then what the health administration has been doing currently is to test all health officials. So the medical staff or the medical professionals that are in the various health centers are being tested. And so we go to Mori, for example, the returnees, those fishermen who were returning from Ivory Coast and other neighboring countries, were also quarantined, and then some tested negative, others tested positive. But this, as of Wednesday, 13 health professionals or officials from the Mori facility alone, 13 of them had tested positive. We go to Upper Dejpa East, where 2, and now they have 3 cases, but 2 of them are also health professionals. You go to the Mfantiman municipality, and then a lot of the health professionals are testing positive for this virus. Now let's go to the Agafo maximum security prisons, where they recorded their first case recently. And we were told that it was a man who was jailed for 30 years. And then, you know, those who are 7 very long sentences, they are sent to the maximum security prisons. And so when the person was sent there, they have an area that they keep the new entrants there. And so they subjected him to some tests, and then they realized that the man had tested positive. So they decided to do self-isolation. They decided to also isolate some of the prison officials. As we speak, the results for the 7 prison officials have not yet been given them. But what is currently happening is that they've started testing all the inmates of the Ankafo site, the Ankafo maximum security prison, plus the officials at that place. And so that is what is currently happening. Wow.
Well, that's a lot of work and a lot on our hands at the moment. Yesterday, though, we spoke to the prison's PRO, who told us that 12 officers are having to self-isolate, which means that there's an addition to the initial 7 that we knew. Right now, he says the figure it stands at 12 officials who have had to self-isolate. Maxwell Kudeko has joined us. But Maxwell, it's good to have you. Let me go to Precious Semevo, who is joining us from the Bono area. Precious, what can you report from your side?
Fortunately for us, our situation here in the Bono region is not as serious as other regions have already, reported. In the Bono region, as at today, we have only one confirmed case, which was confirmed by the Health Directorate in the Bono region on the 8th of May. It happened in Sampa district, that is the Damanhort district. And this particular person is a Togolese national. He showed signs of symptoms of COVID-19. He was tested, and it was confirmed that indeed he has the virus. Measures were taken to isolate him, and then treatment started. But as at today, the Health Directorate, tells me that he is well and he has been repatriated to his native country, that is Togo. So as at now, in the Bono region, we have only one confirmed case in the Sampa, and even that he is well, has been repatriated to his native country, that is Togo. But according to the Regional Health Directorate, as much as they are trying their best to sensitize the populace as to the need to adhere to the safety protocols of the COVID-19, some few challenges, some few recalcitrant ones are making the job a bit difficult for them. Particularly if you go to the market, which as of now we have satellite market, one of them notably at the Sunyani Coronation Park, where market women, have been sent there to ensure that social distancing is adhered to. Even at that, it is not properly being observed. My visit to the Coronation Park this afternoon clearly showed that as much as they are trying, but it is still not the best. More work needs to be done. When it comes to wearing of the face mask, Gifty, I must say that it is a serious challenge for authorities here in the Bono region, as it is becoming sort of a fashion. People just wear it and drop it under their jaw so that in case they meet an official in town who is tasked to enforce the wearing of the face mask, then they'll put it on. I think that is a disturbing situation that we have in the region. Now, they are also saying that the washing of hands under running water, it started nicely, but as the days rolls by, the intensity seems to be going down. And that is also an area that needs to be looked at. Now, within the last 1 week, I've traveled to some districts in the Bono region, the Brekum, Doma, Banda district, Wenchi, and the likes. And I must say that some districts, if you go, you hardly see anyone wearing the face masks, particularly the Banda district. It was very, very difficult spotting individuals wearing a mask. If you talk to them, they just seems not to be concerned or bothered by what is happening in the country. They believe that it is far away from them, and unless and until they hear of a case closer to them, probably that is when that they will start adhering to the protocols.
Some level of complacency we're seeing. Some level of complacency we're seeing there, which is what we also reported in Obuasi before we started seeing the cases surge. But if we're seeing all these problems, and I'm sure that officials have seen it. If they haven't, as you have reported, hopefully they've picked it up and they will be working on the areas that you have highlighted, Precious. But is it that more tests are not being conducted? What do we know? Are more tests being conducted? Because it is when you conduct a test that you know. If you don't conduct a test, you'll probably be thinking there's only one. Do we know if more tests are being conducted or not?
As of now, for them to conduct a test, then it is as a result of contact tracing that they will conduct tests. But voluntary testing or mass testing is not happening as probably is happening in other districts. But let me also put on record that with the complacency aspect of the adherence of the safety protocols, the Sunyani Municipal Assembly, led by the Chief Executive herself, Madam Banahini, she has formed a task force together with the other security operatives, and they are going around the town ensuring that whoever comes into town, particularly the town central, will put on the face mask, or else you have to just go back. And some few, beatings goes on here and there. Occasionally, you see people having challenges with security operatives trying to enforce the law. But as I was trying to say, in the Ahafo region, as at now, we don't have a confirmed case in the Ahafo region. Now, just about a week ago, one case was allegedly confirmed at Dema in the Tano district. But we understand from the Ghana Health Service that this person was a contact tracing from Obuasi in the Ashanti region. And after his samples were taken, he moved to Dema even before his result, could come out. So after tracing him, they only did that or found him in Dema. Apparently, he had contact with a lot of people. But the good news we are having from Dema in the Tano district is that all those who had contact with him, their samples taken, they all came out negative. So as at now, in the Bono region, we have only one. In the Ahafo region, we have none. And protocols, adhering to protocols is a challenge that authorities will have to work harder for us to achieve that.
Okay. So Anas Sabit, who also is in the Bono area, has been doing some checks for us in the markets. Take a look.
All of them has been proven negative. That does not mean that we should be complacent, because the pandemic is real and we need to continuously adhere to the precautionary measures. So, of course, yes, we have not registered a case. That doesn't mean that we are going to relax in our putting in place all the check systems and then the precautionary measures.
I know you've toured the entire region some weeks back. After the tour, what checkups are you putting in place to ensure that the people at the other areas continue with the fight as expected?
Well, the tour exposed us to a lot of loopholes, and then that was the essence of the tour, and we've corrected that. After that, we met the team, the leaders of the district, and then those where we were lacking were corrected, and I believe it's getting better. You cannot expect 100% compliance, but you could see that the message is sinking deep to the grassroots, and look at the adherence measures, especially when we started the tour, face mask was just underused, but now you could see that it has improved a lot. And I believe going forward is one of the precautionary measures that is helping.
Anas Sabit had that interview with the Bono East Regional Minister Kofi Amwakohene. I'm going to go quickly to the Eastern region. Maxwell Kudeko standing by. Hello, Maxwell. Maxwell, do give us a rundown of what's happened in your region so far.
Well, the COVID-19 started basically in the Lower Menya district, and that spread through to the Sojaman district. But as you speak now, there seems to be an even distribution of positive cases across the region. For now, the Fantiakwa North district, the Nchembol district, Ekrapim North, Ekrapim South, Lower Menya, Sojaman, West Achim, Kwa West, New Jabin, North sub-constituency, and Abrim have all recorded cases. Now, according to the Regional Director of Ghana Health Service, Dr. Apeta Brichum, the Eastern region have recorded a total clinically positive confirmed cases of 170. 170 cases have been recorded so far in the Eastern region. We've not gotten to the end of the tunnel yet, but we seem to be seeing some light. Now, out of the 117 cases recorded, we have had 86 recoveries. So 86 persons who tested positive have recovered. The good news is that all the people who were tested positive in Lower Menya, especially those who worked with the Afcon construction firm, all of them have recovered fully. And the 12 persons in Sojaman have also recorded. Now, the other person in Begro have also recovered from the virus. So if you want to do a proper deduction or addition from the cases, the Eastern region as a stand now have 31 confirmed cases. We are told that health authorities are still waiting for more results, but we can report that only 31 confirmed cases so far are pending for further interrogation. Director of Health Service informed us that they are seriously treating people and they expect that by the next test, by the time the next test results will come, they should be able to clear them from the virus. However, we are also told that 13 health officials who work closely.
But I do have most of our correspondents. I'm going to wrap up with all of you. Are you there, guys? What I want you to do, is to tell us how covering this has been for you in the region. Finally, briefly, each of you have a go at it. Tell us how covering this pandemic has been for you personally. Shall we start with Martina, you in the northern region?
Okay. A lot of people around still do not believe COVID-19 exists. And so people are a bit careless and reckless. That gives you the sense, joining any group or reporting amongst people, you need to be extra careful yourself to stay safe. Mm-hmm. And so covering it is a bit hectic because you don't know who is positive or who is negative. And so you have to take up the responsibility to keep yourself safe. That's how come I say it's a bit difficult and challenging.
Thank you, Martina. Thank you very much. Ina?
Yes, Gifty, it's becoming more serious and more dangerous in the Western region because you do not know who you are meeting today or who you are meeting tomorrow, even though you are observing all the directives and all that. So going to do the things you usually used to do or going into the communities has become very difficult, especially when you get to the rural folks and then they think there is nothing like COVID-19, is something for the rich and those in the cities. It's difficult, it's not easy going about your duties the way you really want to.
All right, Ina, thank you very much. I'm not sure who next, but Albert, you're there, right? Albert, let's go for you.
Yes, I'm here. Yeah, so just like Martina and Ina have already said, the challenge is basically the difficulty in keeping yourself safe. But I need to say that in the Upper East region, people are beginning to take it seriously. And for most institutions, when you go, they insist that you wear a mask before you are allowed entry. About 2 days ago, I went to do an interview with the regional minister. And on her door, it was boldly written there that no mask, no entry. So I would say that in my region, a lot of people and the institutions are, taking measures to keep everyone safe. But then sometimes, even as a person, you tend to forget because this is not something you do all the time. So maybe you are interviewing someone, you need to sneeze or you need to clean your sweat, you pull down your face mask. Sometimes you even forget to pull it back up.
I know,
so,
right?
That's just one of the things. But then I would say that it's been generally smooth for me.
It's good to have you as well, Albert. I'm going to go to Anas Abid, who has just joined us. Anas, let's take your quick update, and then you tell us how it's been for you covering this personally, the very unique personal stories there are to share.
Well, Gifty, here in the Bono East region, the region still remain one of the few regions without a single COVID-19 case, and as a result, authorities here in the region have been putting in measures to ensure that the region will remain COVID-19 free. They've taken it upon themselves to tour the entire region. I'm referring to the regional minister, plus some regional executives touring the entire region some weeks back. And during my engagements with the regional minister this morning, he indicated that even though we do not have a case yet, they are ensuring that complacency should be out of the thoughts of the people. In fact, some parts of the region, the education is very positive. Talk of Tichima and Nkranza, Kintampo, people are complying to the safety measures being put in place. But the situation is not the same with other parts of the region, heading towards Sydney East and Sydney West plus Peru East and West. The areas are quite not abiding by the directives, especially with the use of the nose masks and then the directive on hand washing, plus the use of other PPEs. Those areas are still need much education, except that from what we are picking now, the situation has been improved now compared to when we visited the areas some 2 weeks ago. So that is the situation for now. And measures, among the measures that have been put in place is to ensure that security points are put at border posts, areas that shares border with districts that are having confirmed cases. Right. In Keji, for instance, right after the lake, they have cases in the Volta region. So they're ensuring that the ferry plus other routes that connect to the region are being properly secure to ensure that people are not importing cases in the region. So far, I think this is briefly the situation here in the Bono East region.
Anas, thank you very much for that update there, and thank you all our correspondent. Next time we should have more of these conversations. Next time I'd love to hear about the good things that have happened because of coronavirus, so we can work around that one as well as we wrap up on today. I'm told that I ran out of time, so I'm unable to come all around to get your personal, unique stories. Let's put it together for the good stuff when next we have this conversation. Thank you all very much. I've been talking to Martina Buguya, Northern Regional Correspondent, Upper East Regional Correspondent, Albert Sori. We were able to have Rafiq Salam, but certainly we'll have him the next time we do this. And I've had Inathalia Kwanza, Western Regional Correspondent, and Nat Sabit, Bono East Correspondent, Maxwell Kudeko, Eastern Region Correspondent. I think I haven't left anybody out. We also had Precious Semevo, Bono correspondent as well. So if you live in this region, I'd love to hear from you. Some of you have already started sending your messages. You've seen the concerns that our correspondents have raised. What can you do in your own small way to change the story for the better? If you heard the reports that they brought to us, what can you do to make the situation any better? We'll have more of this conversation, trust me, as the week goes along next week. But some messages here. In the Upper East region, this one says, I believe it is the sacrifices that we have done in our various shrines for their request. All our local communities have suppressed the spread of coronavirus in the region. Donald Ananga, you are a traditionalist. You send that in. Thank you for sending your message. Good afternoon. It says, please, I want you to bring people to that Volta region, Bando, Toko. The leaders are selling Ghana water meter, to us. So there's a water situation there as well. Finally, about 22 assemblies at Takwan Siayim to confirm the appointment of MC Benjamin Jesse. That's also a story that we brought you earlier on News Today. I'm going to take a very quick break. When I return, we'll take a look at the global perspective. We'll go to Germany, and then we have our head of health desk, Fred Smith, bring us a wrap of what's happening around the world. Do stay with us. Welcome back. Let's go live to Germany right now. Thomas Power is political correspondent with our partners TW. He's standing by to bring us up to date on the situation. As you know, the last time we had a chat with him, we indicated that the parts of Europe are opening up their borders once again. There's also easing of restrictions. This afternoon, we're hearing that there are some protests. Thomas, it's good to have you, and thank you very much for your patience. Give us an update on these protests. What are they for, and have they ended?
These protests are actually ongoing. I mean, they started a few weeks ago, normally at the weekends, and it is important to stress that it is a rather diverse group of people who are protesting against the restrictions. It's a bit paradoxical or ironic that these protests actually come or have grown as Germany eases those restrictions, but what these people are actually protesting against is those restrictions as such. You have a very varied group of people, from people who reject vaccinations to people who defend civil liberties to people who are in favor of conspiracies or myths. It's a very strange, diverse group of people. It's been described as a sort of loud minority, and it's important to stress this, Gifty, because when you look at different polls, it is clear that the majority of Germans, and that's not only one poll, but various polls, have stressed that they support policies by the government at a federal level and at a regional level as well. So we're talking actually of rather small groups of people who have been gathering in different German cities to protest against those restrictions. Nevertheless, they have caught the attention of authorities who are worried that those protests could actually be infiltrated by far-right extremists, for example, or other groups, and that they could actually turn more difficult and even violent. We've seen some instances of violence, for example, against journalists in those protests, so it is again something that does concern authorities. It is something also rather difficult to understand because, as I said earlier, when you have Germany easing its restrictions, at the same time you have people who go out to the streets on different occasions in small numbers to protest against restrictions. So this just gives you an idea of what a small part of the population here in Germany is up to and what they think of what's happening. Again, it's important to stress that a majority of Germans are actually in favor of what the government has been doing and how the government has been easing those restrictions.
It's very interesting the way you put it. Now, when the restrictions were eased is when these people went on the streets. They're probably saying they don't want any more of the restrictions going forward. Speaking of which, you told us the last time we talked to you this week that the borders are beginning to open up. Has it started already? How did it go?
So the borders have indeed begun to reopen. So the border, for example, between Germany and Luxembourg was opened last weekend, and border restrictions with some of the other countries that Germany has borders with, like France, Austria, Switzerland, those controls have also been reduced. That is going to be a process that will be around until about mid-June, when the idea is that then the borders will be completely opened. As you can imagine, this is a rather difficult process because you have to discuss with the other countries exactly how that will work, not only what people will be able to do when they cross, but what kind of hygiene measures or social distancing measures will have to be put in place, and what type of work between authorities in both countries will be like. It's important, all this, Gifty. I went out today here in Berlin to film a report and ask people in different parts of Berlin what they actually think, not only about the borders, but also about all the other restrictions that have been eased. And you do get a sense that many people are happy about the way things are going, in the sense that they can go again to restaurants or cafes, that they can go again with their kids to playgrounds, that there is a sense that they don't have to be at home all the time. But there is at the same time a sense of concern that was also very clear to understand today, that maybe some of those easing of restrictions, some of those restrictions that were eased came too soon. And one person even said that she thought that even the case of the borders was too soon, too quick. So I think Germans in general are a bit ambivalent. They have a sort of mixed feelings. On the one hand, they're happy because they don't have to be at home all the time, especially now that the weather's so great here. On the other hand, they are concerned because the more they ease restrictions, the more relaxed Germans are, and this could also lead to a sort of increase in the number of infected people, and that is obviously something that has not only citizens but also the authorities concerned.
There is no easy balance here at all, but has there been any outcomes from the recently resumed Bundesliga? I mean, anything fallouts that we should know about?
There's something interesting, not about the Bundesliga, but about this issue of the restrictions. There are those who say that actually getting out of lockdown is more difficult than getting into lockdown. And when you get into lockdown, it is actually easy because the government can actually say from now on museums are closed, or from now on restaurants are closed, or from now on kids will no longer go to school. But once you do the opposite, once you start opening up again, that is a very difficult process, because you have to give people the understanding that yes, they can get back to some sense of normality, but at the same time, they still have to take care and they still have to be responsible. And by the way, that also applies to a large extent to the Bundesliga, because the Bundesliga restarted last weekend. There are more matches planned this weekend, big matches as well, without any fans in the stadium, with those measures that we already discussed. those hygiene and social distancing measures. And that, again, is one of those issues where Germans are divided. On the one hand, they do believe that it's good that football is back, especially the fans who have been waiting for a long time. On the other hand, people are concerned that this, again, could be a bad example in a way, and that the focus maybe should have been placed on other areas of German society. And there are those who have also criticized the reopening of the Bundesliga because they say that essentially it was done because of economic interest and not necessarily because they want the sport to be back. So that gives you also the impression of what the debate is here. And it's also, by the way, a debate that has transcended Germany, as other leagues around the world, as other countries around the world also discuss how, under what conditions and when sport can actually go back, and under what new normal that can happen.
It's a conversation we're having here in Ghana as well, and every time we draw our references from the Bundesliga, we're having that conversation here whether or not the Ghana football, the Ghana league should continue. But Thomas, it's good to have you once again. So now that the restrictions are eased, it means that life is pretty normal. We can say that.
It's basically close to normal. So it's been described as an almost complete return to normality. There are things that are still not permitted. So mass gatherings, for example, are still banned. Germans are still not allowed to travel. That is something that, as we discussed, will only happen gradually. So Germans are still very wary of trying to book summer holidays because borders are still not entirely open, and there is still a worldwide travel warning from the German Foreign Ministry. People still have to wear face masks here when they go out, when they're on public transport and in shops, for example. They still have to maintain social distancing, so they can't meet with a large group of people. So all these things are still indicators that the situation is not over completely, that Germany still faces a challenge, and that the situation could become rather different if the numbers go up again. That's why Angela Merkel said that it would not be very good if Germans, now that they are basically back to normal, and important to stress the word basically or almost back to normal, if they simply let that opportunity go because they're not responsible enough when it comes to keeping social distance and maintaining those responsible attitudes when it comes to their interactions with other people.
Very healthy balance we need to strike. The need to have some semblance of normalcy and the need to still protect ourselves against this virus. Thomas, thank you so much for today. Thomas Sparrow there is political correspondent with our partners DW. Every week he joins us with details of what's happening in Europe and also in Germany. Well, we're hearing that Germany is easing restrictions slowly. Now they've opened up the border with Luxembourg and some other countries. If you live in those areas, well, good news for you. But we keep monitoring to see how that impacts the spread of the virus. Now let's take a look at the global situation. Fred Smith is head of our help desk. He's joining us via Zoom with the global outlook. Fred, tell us what we should know as far as the global outlook is concerned.
Well, the cases we have around the world have currently increased past the 5 million mark. And if you look at the United States, for instance, they have more than 1.5 million cases. It's followed by Russia with more than 326,000 cases, Brazil with 310. So in terms of top three, these are the countries. And then in terms of countries with the number of deaths, you still have the United States leading that, and many of the states in the United States are leading in terms of the deaths. Looking at what's happening around the world, in Brazil, for instance, where we have the world's second highest number of cases, their deaths have surpassed 20,000, and they have more than 20,000 cases. And then in China, everything is back to business because, if you recall, if the Congress was delayed, and it's as a result of this resurgence of coronavirus cases. And then in Spain, we know that they are also easing the restrictions there. Whilst in the Middle East, we know that 10,000 Iran medical professionals have also tested positive for it. And that's in terms of the world, what's happening. But Gifty, I'll tell you what, Ghana and other African countries are seeing slow in the number of cases they are recording on a daily basis. However, we need to be very concerned about Nigeria for the West African sub-region. As we speak, Nigeria, with 7,016 cases, they have as many as 211 deaths, and that's very alarming. That's out of the 578 total for the sub-region. Nigeria alone with 211, Gifty.
And Fred, in terms of recoveries, is there any good news to, point to?
Well, indeed, we're having more than 10,000 recoveries in the West African sub-region. That's out of the total of 27,000 cases that we have, 10,000 recoveries so far. And we also have 16,162 cases that are still active.
Well, Fred, thank you very much. But do we have any information as far as, your sources are concerned with Ghana's situation? It's been a while.
Yes, indeed. Ghana's cases continue to climb, but on a slow scale because we have been able to clear the backlog. And so the number of cases that we'll be hearing going forward will be reducing. Even though we still record cases, will be on a declining scale.
And so having said that, I refer you to what Albert Sori told us from the Upper East today when we went on the regional, connected with the regional correspondent. He said that for the past about 2 weeks, he wasn't so sure, I must say, for about 2 weeks, they've been at 26, the Upper East region. Looks to me like something good has been done in the Upper East region. Bono has had one case for some time and it stayed that way. But then the correspondent also says that people are not really adhering to the protocols in some places. I get the inclination that perhaps we need to conduct some more tests there. I don't know how you see this scenario.
Well, I think that the more tests that we conduct, the more cases that we will be able to find. And so as the contact tracers continue to look for persons who may have been exposed, we're likely to get some more cases. But as I said earlier, it's not likely as high as we've had in the past.
And what do you think about the central region and the western region? They're seeing some real quick jumps there. Natalia reported about how the numbers keeps increasing, especially in the western region, which didn't have a case as at when the epicenters, Accra and the Ashanti region, had a lot of cases. What are your thoughts on that as well, Fred?
Well, Gifty, the lockdown was lifted some weeks ago and people continue to move. And so if persons who've been exposed in, say, Greater Accra region and have moved to the central region, they are likely to spread over there. And the lifting of the restriction mainly may account for rising cases in some of these areas. But of course, it's also not clear how people are moving. And we would expect that maybe once we have the lockdown lifted, we'll be able to conduct some more contact tracing and enforce the measures that were announced by the president in his previous messages.
Well, Fred, thank you very much, and I hope you're having fun, you're taking care of yourself and staying safe.
Yes, I am, Gifty. I hope you are too.
As you can see. Fred Smith is head of our health desk here. He's also producer for the show, lead producer for the show, I must say. He joins us from home as he takes a look at the global picture and helps us with a bit of analysis on the situation that our correspondent reported on. But let me tell you what the WHO is saying about Africa. Dr. Matshidiso Moeti is the WHO Africa Director. He's been giving some updates on our situation here on this continent.
In the WHO African region, the COVID-19 pandemic has reached every member state, and over half the countries have community transmission going on. Although case numbers are seemingly low, African countries and people are equally important to WHO for support. Much has been said about the weakness of African health systems, and many African communities are very vulnerable because of socio-economic determinants. With food insecurity and exacerbated economic distress, governments are having to balance lives and livelihoods in this response. We are concerned that over 1,600 health workers have been infected and that cases are increasing in humanitarian settings. Governments are working day and night, and WHO and partners like the Africa CDC are supporting them to save lives. Global solidarity is urgently needed to address shortages of test kits across the region and ensure equitable access. We have repurposed more than 900 regional and country office staff and deployed 100 international experts. And we are working with governments and partners to establish humanitarian corridors to provide additional support and supplies. Our assistance in developing national response plans has helped to mobilize over $300 million for public health actions, and we are coordinating with other UN agencies and partners to mitigate the socioeconomic impacts of COVID-19. We are seeing results. Namibia and the Seychelles have not reported any new cases for over a month. Côte d'Ivoire has reduced the spread of cases to the periphery by building on existing primary healthcare interventions. South Africa and Mauritania have mobilized thousands of community health workers. In the Democratic Republic of the Congo, health educators are sharing information on Ebola and COVID-19. Zambia and Zimbabwe are using real-time polio surveillance to track the spread of cases. As we fight this pandemic, we cannot lose sight of other priorities. The African region is on the verge of certifying the eradication of wild polio virus. This is a major public health milestone in Africa, and lessons and tools from this experience are helping direct the COVID-19 response in countries. Modeling studies by WHO and partners show that deaths from HIV, AIDS, and malaria could dramatically increase if essential services are disrupted. Countries are reporting stockouts of vaccines, and immunization campaigns have been postponed. These complex challenges call for regional and global solidarity, innovation, and equitable approaches to protect the most vulnerable among us. We count on this to succeed in making health a reality for all.
Dr. Moeti, the WHO representative for Africa. Now, government has granted Kuwait permission to bring back some 245 Ghanaians who have been deported as Ghana's borders remain closed. Speaking at a press briefing on the decision, Information Minister Kojo Nkrumah stated that the deportees will be mandatorily quarantined, and those who test negative will remain in quarantine for a second test.
The government of Kuwait has informed the government of Ghana of an intention to deport some 245 Ghanaians who are currently in Kuwait illegally. The government of Kuwait has further requested permission from the government of Ghana to bring these persons into the Ghanaian jurisdiction on Saturday, the 30th of May, 2020. The government of Ghana has subsequently granted a special permit for the admission of the said deportees to Ghana. This deportation is to be executed via a special charter flight arrangement at the cost of the Kuwaiti government. Now, this deportation comes at a time when Ghana's borders remain closed to human travel as part of the international travel restrictions under Ghana's COVID-19 response program. As you would recall, the restrictions are to limit the importation of cases into Ghana. However, even after these restrictions were imposed, we have granted special exemptions for some countries to evacuate their citizens from our jurisdiction. The government of Ghana, in line with some of the exemptions granted earlier, hereby announces the following measures to safely admit the 245 deportees from Kuwait into Ghana while ensuring that the risk to the COVID-19 response program is mitigated. Number one, the deportees will be mandatorily quarantined and tested for COVID-19 immediately upon arrival into Ghana. Number two, deportees who test positive will be given the necessary supportive treatment. Deportees who test negative will remain in quarantine for a second test at the end of a 14-day quarantine period. The cost of quarantine and treatment is to be borne by the government of Ghana. The National Security Secretariat has been instructed to work in collaboration with the military, the immigration, and the police to take responsibility for ensuring that the mandatory quarantine is adequately enforced. The Ghana Health Service is been asked to take responsibility for the testing and, if need be, treatment of these deportees. The general public is hereby assured that all measures to ensure the health of the general population and to ensure that the gains of the COVID-19 response program are upheld are being undertaken, even at this time, by the government of Ghana. The potential deportees from Kuwait, these are persons who were found to be staying illegally in Kuwait. The Kuwaiti government has gone through their processes and has satisfied the government of Ghana that these are Ghanaian citizens who are illegally staying in Kuwait, and the government of Ghana has given that permission, that special permit that aircraft containing them can land. I'm trying to confirm the date. It is actually tomorrow. It is tomorrow, not the 30th. It is tomorrow. It is tomorrow that they will be getting to Ghana. So they will be leaving Kuwait tonight, and then they will be getting to Ghana tomorrow. And we have triggered the process to ensure that we can receive them, we can mandatorily quarantine and test and ensure that they don't become a threat to the Ghanaian population, if indeed we have some cases in there.
The minister also says sanctions must apply to Ghanaians who are aiding people get into the country illegally.
The reason for which on a daily basis we hear 40 people arrested here, 60 people arrested here, 80 people arrested here, the reason for which you hear that is because the Ghana Immigration Service and the Ghana Armed Forces have significantly stepped up the fortification of our borders, both on the legal entry points and what is known to be some of the illegal crossing points. The Ghana Immigration Service has on its own put up about 700 men and women to augment their already existing numbers. The Ghana Armed Forces, through Operation Conquered Fist, is supporting that exercise. That is why they are able to get the intelligence, make these arrests on a regular basis, which you, our colleagues, are doing very well by reporting. And then we get the sense, particularly of some of our own citizens who aid and abet these persons who want to come into the jurisdiction illegally. That's the first one. The second one is that, yes, there ought to be some sanctions, and indeed instructions have been given that sanctions must apply particularly to Ghanaians who are in the business of aiding and abetting people without authority to cross now that our borders are closed. The little nuance in that is that as part of the COVID-19 response program, you would notice that arrests, keeping people in custody and related matters are very sensitive and therefore are not handled with the normal dispatch and, may I say, even aggression that you see. Indeed, we had one incident here in Accra where some persons arrested, put in police custody, later tested positive, police persons associated, you have to go along with it. So now, even for the police and the prison service, they have a protocol that when people are, for example, sentenced or people have to be put in custody, they are not commingled with the general population. And so that affects how quickly you can see some of these things in terms of the sanctions side also happening. But those sanctions must happen. I do know that instructions have been given that we should find a way of getting those sanctions applied quickly and announced so that it serves as a deterrent to other persons.
Kojo Nkrumah there. He also indicated that the Foreign Affairs Ministry has been providing support to some Ghanaians who are unable to come into the country as a result of the border closure. He says the data is being studied and the decision will be made on a cohort basis.
A lot of data has been gathered. What we are going to do is to treat it on a case-by-case basis. So all the other categories, as I mentioned, will also be examined on a case-by-case basis. And where the examination shows clearly that it is possible to handle it in a manner that does not pose a risk to the general population, I'm sure the decisions that are made thereon, as we are doing this morning, even at this short notice, will be communicated to us. So as of now, no firm decision has been made in a blanket manner. It's been handled on a case-by-case basis. Can I give an update on the data that has been gathered so far? The numbers are in the thousands from all over the world, from the Americas, from Europe, from even West Africa, and parts of Asia. The numbers are in the thousands, as in the numbers of persons who have given us information about their status. I hope you understand me. I'm not saying that thousands of people want to come back. I just need to be very clear on that. You have another tall assessor. So the numbers of Ghanaians who are giving us information are in their thousands, but they are being examined on a cohort-by-cohort basis or a case-by-case basis, so that a good decision is made without putting the general population and the gains of the COVID-19 response program so far at risk. And perhaps I must even start by saying that our heart goes out to all our compatriots who are out there, who, for one reason or the other, because of the closure of the borders, are not able to ordinarily freely move into the Ghanaian jurisdiction. Our heart goes out to them. Indeed, if you speak to the foreign ministry, there have been times when they've had to intervene and provide accommodation for some of these persons, some of who were sleeping rough at a point in front of embassies and other places. They've had to do some work to ensure that some of our compatriots are given some minimum support where they are. But on a cohort-by-cohort basis, we continue to examine, and this is why it was important to gather data earlier. And that data that has been gathered is being analyzed. That analysis helps us to understand the circumstances, the possibilities, the feasibilities, even of containing some particular cohort if you do allow them to come into the Ghanaian jurisdiction. So our heart goes out to them. It is a matter of concern to the president and the government. That is why we've tried to get data and use that data to make a decision.
I'm joined by Charles Oredu, his Deputy Minister for Foreign Affairs, so we can get more of this story. Mr. Oredu, thank you for your time this afternoon. Now, let's start with when these deportees are expected back into the country.
All right, thank you. So we are expecting about 245 Ghanaians from Kuwait tomorrow. And as per our preparation today, led by the National Security, we did what we call a mock exercise, a simulation exercise, so that when they come in tomorrow, the process will be as smooth as possible. So all the agencies, you know, the airport authority, the police, the ambulance service, the prison, BNI, CID, National Security, we were all there. You know, myself, the Deputy Minister for National Security, Deputy Minister for Transport, you know, to see to it that, you know, at least for the simulation, everything is in order for us to receive our compatriots tomorrow.
So they're coming tomorrow. What's really did they do wrong to be deported? Usually deportation is attached to one offense or the other.
Okay, so these are, you know, they are various categories, you know, but some are people who have documents that the authorities there claim to be fake. Some are people who run away, especially the women, the ladies, you know, those who run away from their employers, you know, because of the treatment that they were facing. You know, so when you run away, you find yourself, say, in a place where you hide from. You know, their structure is such that you should always be in the home or in the territories of your bosses. Okay. You know, the bosses will hold your documents, your passport, and you know the situation that we are confronted with in the Gulf states. So the very moment you leave the confines of those spaces of where you are supposed to work, then that means you go without any documentation. And when you are arrested, then I mean to flouted one of their laws.
I see.
So these are the categories of people that we have.
Okay.
Now, what the country did, that what the state, Kuwait did, was that they opened up that, okay, now we want to grant amnesty to all people who are here illegally. If you know you are in this country illegally, then we are granting you an amnesty.
Okay.
So if you take up this offer, we are prepared to fly you to your country of destination. And that is exactly what this category, or that's exactly what these people took advantage of. So it was an amnesty that these people took advantage of, and then that as we speak now, I think that they are being kept in a very humane environment, ready to board the aircraft, to Ghana tomorrow.
So amnesty and domestic workers who have left the jurisdiction of their bosses, so to speak. But in terms of deportations, what indication does the ministry has? Should we expect more in these times? And should we expect more of such arrangements since our borders are closed?
Yes, I guess so. Because in part of this, I know you are quite conversant with some of the repatriations or some of the deportations that we've had, from the U.S., from Europe, from some of these other countries, and especially from Libya, as a result of what is happening in Libya, with the support of IOM, for example, the International Organization for Migration. They've assisted us in bringing home some of Ghanaians who were caught in the conflict, on their journey to cross the Mediterranean. So it's something that's been ongoing. Yeah, something that has been ongoing. So I as of now, as we speak, we don't have any data, for any possible deportation apart from what we have tomorrow. And then, but I'm sure that this will not be the end. There may be some more deportations when those countries deem it fit.
And talking about data, you do have data for the evacuation because you've been gathering data. In fact, you've invited people to send in data, Ghanaians who are stranded or who need to be evacuated for one reason or the other. What's the plan? Where are we at the moment? And what's the update?
Okay, so the update that we have, what we've sought to do is to categorize these people. So we have those who have the ability to pay, those who've gone knocking on the doors of the embassies or the ambassadors that they are willing to pay once an aircraft is provided, then, or once the Ghana airspace or the borders are open, they are ready to pay for any evacuation. These are made up of business people, private individuals, students, that private sponsored students, government sponsored students who are yet to complete their courses and not. We also have some who were funded by government to travel. You have people in the ministries, government agencies who traveled for a conference or a meeting, and they found themselves unable to come back, because of the lockdown. You also have some students, government-sponsored students, who were sent out there, for further studies, and as a result of the closure of the airport, they are unable to come. Then the third category, it will be for the deportees, like what we're expecting tomorrow from Kuwait.
Okay.
So these are the three main categories of people that we have. And in terms of the data, we've gotten names and details from as many countries as possible. But this is just the raw data. Ours was to collate that data. Once we have that data, government will take a decision on the data that we have. So we forwarded this data to the Office of the President, and then I hear that discussions are ongoing as to the next line of action, whether to allow some of these people or all of them to come in or not. I think that's the decision that we are waiting to take.
Is there a timeline we can look at?
As of now, it will be difficult for me to give any timeline. We've done our job. When the President met the ambassadors, the President asked them to make sure that they have this data ready. Okay. So once the data was ready, they forwarded the data to us, and we presented the data to His Excellency the President. Yeah. So we're expecting the President to pronounce on this. He's always said that whatever decision that is going to take, as to this pandemic, would have to be led by either science or data. So this is the data. We presented the data to him, the section is the president, so we await his decision on this.
Okay. Well, Mr. Redu, thank you very much. But the minister said that you're providing some sort of support to Ghanaians. What sort of support is he referring to?
Oh, we've had situations where, even in the case of for example, Ghanaians were being ejected from their homes. You know,
in China?
I'm saying it's an example, like in China. When I guess you read reports.
Certainly. What have we done about that situation, sir?
Yeah, so in that case, for example, you know, we got the mission or the embassy in Guangzhou and Beijing, you know, collected some of their bedding, you know, some of their clothing, some of their bags in safekeeping. They also helped them get some hotels that they could sleep until such a time that the matter was. But as I speak to you today, that matter has been resolved. The Chinese, you know, came out to apologize profusely. They think that, well, there was a miscommunication between their own setup and that they do apologize. So they've gone ahead to provide some bedding, some accommodation for Ghanaians. So we don't have such reports again, you know, Ghanaians being ejected from their homes. You know, I think the matter has been resolved now.
So thank you very much for your time, and we'll be coming back to you for more details on the evacuation plan, since a lot of people are looking forward to it as well. Charles Oredu is the Deputy Minister for Foreign Affairs and Regional Integration. Well, Ranking Member on Parliament's Foreign Affairs Committee, Samuel Okujeto-Ablakwa, has been reacting to the government's response as far as evacuating stranded Ghanaians are concerned.
Before Ghanaians join or embark on those flights, they will be tested. You must test negative. When you arrive, you will be quarantined. So I think that the whole policy of government towards Ghanaians outside, Ghanaians stranded abroad, has not been thought through. It was not considered at all. There was absolutely no plan. And so you notice that initially there was propaganda, heavy propaganda, that hey, the minority wants the virus imported to Ghana. And check all the other countries who did evacuation. That is what sent the virus to their country. Fake news. And sadly, some of you in the media perpetrate this fake news. There is no evidence whatsoever that any country got this virus or had this virus imported into their country because of evacuation. Not one country. Italy, they have found the first people who tested positive. They were doctors, tourists. France, Germany. There is no evidence, no scintilla of evidence that any country engaged in evacuation and it led to importation of the virus. It's just fake news, government propaganda, just to cover up for its incompetence and its ineptitude and total insensitivity towards the plight of Ghanaians. And that point must be made forcefully. It is also important to emphasize that evacuations follow WHO protocols and they are safe. Before you evacuate, you are tested. Do you think that the flight crews, they don't care about their health and safety? Pilots, you think they don't care about their health and safety? They don't have family? So evacuations follow safety protocols, WHO protocols. When they arrive, they will be quarantined. So, ladies and gentlemen, let's appeal to our government to do what is right. They owe a duty of care to our nationals. Let us not wait for other governments to be deporting our nationals before we say we are going to open the airports. What is happening now is an embarrassment. We should not have waited for the Kuwaiti government to say, hey, I've rounded up your guys. We've had enough. Other countries have come for their nationals. You are refusing to come for your nationals. As for us, we've rounded them up. We are bearing the cost. If you won't open your airports, it's up to you. So this should serve as a wake-up call, and let us reach out to Ghanaians in other countries. I hope that the collation of data that is going on, I saw the notices from our missions abroad, from New York, Washington, London, and other places. calling for people who are stranded to send in names. That was 2 weeks ago. Again, look at our level of response. So slow. It's as if we don't really want to help. And it's so inept. And you see, we are in a crisis. People are stranded. People are sleeping rough. The information minister himself confirms that they are aware that some Ghanaians are really, really in a difficult place. They are sleeping rough. They've run out of hotel bills. They've run out of upkeep money. And yet, we are here. Initially, we don't want to evacuate. Then we change our position later. Okay, embassies, collate. Let's see what the numbers are. And still no definite position. As we speak,
the government says they are discussing.
Government has still. How long is government going to discuss?
And that a firm decision will be taken subsequently. Isn't the fact that they're allowing the Kuwaitis in, for example, a good first step that at least the will to get it done is there, as far as you're concerned?
I disagree with your use of the expression allowing the Kuwaitis, as if our government had a choice.
Okudzeto Blackwa, minority spokesperson on foreign affairs. Well, a national conversation has started on what the new normal will be if President Akufo-Addo relaxes restrictions on social gatherings. Currently, schools, churches and mosques have been shut to reduce the spread of the virus. But government has said with no vaccines, no cures found, it's time to live our normal lives while observing the protocols to prevent spread. So what do you think about that?
All depends on the number. You know, as the numbers are still increasing, I don't think it should be now. But then it should take a little time. Okay, but with churches and then with churches, for instance, we can, we can just give some distances, social distance. That one there, I think it will work. But with these schools, with our schools, I don't think it will be possible at this time, especially with the young ones. They can, when we say social distance, they wouldn't understand, you see.
Most of our mothers go outside for goods and to sell in this country. But once the border is locked, it's like nothing is really going on. There's nothing in town to buy or stuff. If you list it up, it's okay, but there should be precautions towards it. Schools can be on hold they can even go for at least another year, because with school there's no age in school, so you can wait for another year as in schools. But as in churches, we can fellowship at home also, so God is everywhere.
The president himself is not happy by being lifting the ban, because you know why? The business are being collapsing. The private schools are being collapsing. They are losing a lot of money. So what the government have to do, whatever the case, you have to lift the ban so that business can do what? Can flourish. Because our economy is been sinking. We keep on borrowing money and all that. So what we do, you have to lift the ban so that things can start opening up or even freshen up. We are not like a Western country have been developed. They can do this lockdown for more than 20 or 10 years. No, we are not like that. People are suffering. So, like I said, I'm not happy. But I just want to put myself in the government shoe. The kind of pressure putting pressure on him. So we have to understand him. We can go to church, worship our God and all that. But the question is, how long should it continue for us to be on the impose of the ban? The church can minimize their servicing, maybe 3 services a day. You understand? It's not about making the money, but they also want to do what? Protect the God's children. That's what the church have to do. We should be able to have washing your hands, the sanitizers and everything. The church can provide, because it's the same people providing the money to them.
It's 2 ways. If the ban should be lifted and there should be proper management in the protocols, or following the protocols on this thing, what government has brought, social distance and other things should be followed actually, then I think there's no problem in lifting the ban. But if they lift the ban and people will not follow the protocol, then I don't think the government should do it. Yeah, because it's for our own safety.
Where we find ourselves here in Ghana, I think I won't support the fact that the borders has to be open, because the way you might take care of yourself will be different from the way somebody might take care of themselves. So, yeah, I think it's best we keep it closed until anybody, those responsible for knowing whether or not it's safe can tell us it's safe. So if they open it, it's going to put us at risk. So I'm not sure we're ready for the social gathering thing to continue. Yeah.
Are we ready? Are we not ready? We'll see what the president says about that. But like I indicated earlier, domestic violence has been on the increase. We've been told that we should expect more. There are financial problems in homes and people are having to deal with loss of jobs or having pay cuts and all. This is all because of coronavirus. So today the question is, how is this impacting relationships? How is it impacting families? The initial plan was to open up our phone lines for you to send in your questions for our psychologists to help you answer those questions. But unfortunately, we'll have to just have a conversation with psychologists as we sample the problems they have already received, and then we carry on the conversation next time. So I do have on Zoom with me Dr. Emmanuel Esampong. He's a clinical psychologist, a senior lecturer at the School of Public Health, University of Ghana. He's also a member of the COVID-19 response team. Doc, thank you for your time this afternoon.
Thank you for having me.
So I understand already you've been receiving some requests for assistance as far as psychological support is concerned. What sort of requests are you getting exactly?
Right, so mainly these requests have bordered around people having to deal with the anxiety and fear associated with the disease. There are also instances where people think that for them, it's not something that is closer to them, and so observing the measures that have been put out there, more like a problem for them. Issues of stigma have also come up, and then how best we can actually go about this whole thing said that the responses, that have come from different places, will be appropriate. So to a very large extent, I would say that a lot of the issues that have come up have bordered on, people's emotional stability and how well they can cope.
And that's a very important thing, emotional stability. I mean, sometimes you may look down on it, but you may take it for granted even. But it has a whole impact on you. I'm not a psychologist, you are, so you can even help us with more. But before we go on, can you share with us one or two of those very unique stories that you have heard in these requests as they come to you?
Right, so I think that the very recent one has been people, saying that for them, they don't really believe that there is anything, called COVID-19. I mean, they haven't seen anybody having it, and so if it happens that they are being asked to, as it were, follow the, the protocol that have been put out there, it's as if it's a problem for them. I mean, wearing of their mask, for example, somebody thinks that, because of the names that people have actually associated with the mask, some calling it a mouth diaper, some also saying that it is a brazier for the mouth, all those things. So they are thinking that, well, they are not going to step out there wearing these things for people to, as it were, call them or refer to what they are wearing by those names. And the thing is, more like trying to correct the impression that they have about, doing some of these things. The reality is that this is a new disease. We have not got, much information about, how people can be infected apart from what we already know.
Yeah.
And so, I mean, in the right senses of the scientists, they have come up with very simple measures that, we all need to follow. I mean, I'm saying it's simple because then, bottom line, if you know that you don't have anything to do out there, then you stay put in your home so that, I mean, there won't be the need for you to, be wearing the mask, be washing your hands and, all those things. I think that is what, most, people should be looking up to instead of stepping out there and not wanting to do, follow the measures when they actually may give the disease to somebody or they may contract it from somebody.
Now, talking about wearing of masks, I mean, the President of the United States, Donald Trump, is one of the biggest people who think that wearing of the mask is not necessary. In fact, he calls it a political hijab yesterday because he had one, but he didn't want to wear it for the media to capture, for other people to see. And for people who think that they don't want to wear the mask because they haven't seen anybody with it, is there a problem? I mean, psychologically, would you say, what is going on in the minds of people who think like that?
Well, you know, I'm hesitant to say that these people have any psychological problems, you know, when I have not encountered many of them. Okay. What I think really is that it's as if the information that we are putting out there, it's coming from the top to the bottom. And you know that, I mean, the cultural context that we find ourselves in are quite unique. And if somebody at the top, already people have all kinds of perceptions about people at the top. Okay. You know, so the thinking is that perhaps we did not resort to the right community engagement. Okay. You know, because I have argued that in every community there are people who wield all kinds of influence, people who have power, people who have authority, said that these people, when they put out anything, the community people are more than ready to accept it. You know, so having gone into the community right, how are we able to identify these people, educate them on what exactly we want community members to do? And then they are the ones who are putting the information out there. And the interesting thing will be that these people are also in the community. And so once they put out the information, the expectation on their part will be for these people to adhere to that. But if it is that it is coming from, you know, the top, then it becomes, you know, a bit difficult for people to easily accept. And I mean, like, you know, there are certain people, you know, in the society who, for them, not until the thing has really gotten to them, I mean, they will always doubt that there isn't anything like this.
Yeah, yeah. It's interesting. Perhaps next week we'll be able to open up the phone lines and have people calling to you. But you're part of the COVID-19 response team. So based on what you have received, the request that you have received with the anxiety, the fear, the denial, the stigmatization, and the obvious impacts these will be having on the family and relationships of these people, we can delve into this deeper next time when we have this conversation. How have you responded to these requests that have come through?
Great. So this COVID-19 response team is specifically, you know, located at the School of Public Health, University of Ghana. You know, so again, there's been a lot of misinformation about COVID-19. We have had the opportunity to, as it were, provide, you know, appropriate information to people via, you know, a Telegram app. And then over time, we also realized that issues of stigma were coming up strongly. And so, I mean, we put together a team that quickly developed, you know, some training module. And last week, Tuesday, I think on the 19th or so, we gave the opportunity to media practitioners, journalists, who took part in a Zoom training on how to communicate, you know, issues related to COVID-19. Okay. Let me say that this was a very successful one. I think we extended the invitation to multimedia. Unfortunately, I didn't see any of your people joining, but this was a very good, yeah.
I mean, we'll certainly come for the feedback if no one represented. I'm sure it must have been an oversight because we always respond to some of these calls. But Doc, it's a very good time to wrap up on the conversation for today. But like I said, next time we can have this conversation, and if that's okay with you, we'll open up the phone lines and have people ask the questions that about how this is impacting their relationships and their families, and we get some help for them.
That would be well.
Thank you so much for your time this afternoon. I've been talking to Dr. Emmanuel Esampong. He's a clinical psychologist, senior lecturer also at the School of Public Health, University of Ghana. He is a member of the COVID-19 response team. So do not be burdened by anxiety. Don't be in denial. I mean, don't fear, but do not also be in denial. This is real. People have died from it. It is real. And then do not stigmatize. For emotional stability, work on it. And next week, we'll try and have a conversation, see how we can help with that. Well, unfortunately, I have to call it a wrap. And thank you if you did send a message. I think I've read that. I'm not sure if I do have time to read maybe one or two. But let's see. Okay. So Farouk is sending us from Tamalino. Farouk sends a message every day. Looks like it is frightening, he says, the rise of COVID-19 cases in Ghana. Now that we've gone to 6,486, what is really going wrong? Farouk, I wish I know. We just perhaps need to respect more of the protocols so that we can all be safe. This one says, hello, Gifty. In as much as we need the recoveries to speed up, we need to take the protocols very seriously so we can defeat the virus. Akeli Vincent sent that from Navrongo. Akeli also sends messages quite often. Let me take the final one and then we run over to do Let's Talk Showbiz. Says Gifty, the new normal of online classes is really hard for us. The impact of COVID-19 on our livelihood is enormous. We've been at home struggling to cope with our online classes with challenges of internet access, mobile data affordability, and most of our colleagues missing quizzes because they don't have Android phones. We are badly affected. The government should give us some help. Our allowances, student nurses, the government is not paying and said it's because of this COVID-19. We are struggling with the online classes. Very real issues you're raising there. Thank you for sending those in. I hope the authorities have heard and they'll respond. There's no more news when you log on to myjoyonline.com. Scroll all the way down and you get to see our online video pages where you can follow us. My name is Gifty Andopia. Always, it is a pleasure. I wish you a very great weekend. Do take care of yourself. Remember to wear your mask, wash your hands. And it's easy to forget, but try to give yourself a reminder so you can stay safe. These messages